Good evening, everyone. Welcome to the GSK ViiV Asia Pacific Committee event. Good evening, everyone. Welcome to the GSK ViiV Asia Pacific Committee event. Let's evolve HIV Care. How healthy aging matters. We are very delighted to have our faculty tonight. Let me introduce myself. I'm Tafen Wang, Patient Affairs Manager at ViiV Healthcare. ViiV Healthcare is a company 100% dedicated to HIV. We aim to end the HIV epidemic, and of course, our mission is to leave no people living with HIV behind. Before we start tonight, let me go through some housekeeping. So please note that this event is being recorded to share an on-demand video after the session. We assure that the community attendees tonight will be all anonymous. Our responsibility is to report any adverse events that are raised during this session. Please do not share any information related to your health conditions with us during this event. We are having live interpretations in Korean and Mandarin. Please select your own language channel in the interpretation channel. For those of you who are listening to us in English, please select the English channel. Next slide. So a warm welcome to everyone to our webinar under the theme of Changing HIV Care in Asia. Tonight we will be discussing a topic of increasingly importance. It's about people living with HIV who are aging. There's a growing populations of them who all require appropriate care and a good quality of life. Here are our disclosure of our panelists. Next. Our agenda tonight, we'll start with the 20-minute lectures where we will hear perspective from researchers and the community on what is aging and mental health among people living with HIV and why is it so important. Then we'll have a panel discussions with regional experts sharing their reflections on key themes, including social aspects, because people living with HIV also are facing stigmatizations, also a high level of comorbidities and other challenges. We will hear stories of older people with HIV in different settings. Afterwards, we hope to give you some actionable steps to achieve a healthy aging. We allowed a 15-minute Q&A sessions, so please start posting your question in the chat. We will answer them in that session. So without any further ado, I would like to introduce our great panelists and faculty. So please, Professor Sun, would you like to introduce yourself?
Hi, thank you for having me. My name is Yotong Sun. I'm an associate professor of gender studies at the Chinese University of Hong Kong. I've also been the past vice chairperson of AIDS Concern Hong Kong, and I've also been researching LGBT plus issues in Hong Kong as well as other parts of Asia. And I've also, actually fresh today, I've got a paper accepted on a project that I've worked on, older people living with HIV in Hong Kong. So I look forward to the seminar tonight to learn more from what's going on in the region. Thank you.
Thank you, Professor Sun. So next, Mr. Lee, please tell us about you.
Good afternoon. I am Lee In-gyu. I'm a director of Korean Association for AIDS Prevention, and I'm also an activist. And I have been working at the Korean Association for AIDS Prevention for 18 years. And today, I'm very happy to see you, and I'm very pleased. And today, I hope that we can have a fruitful discussion so that we can contribute to better health of older people living with HIV. So that I hope that this will be a great starting point. Thank you very much.
Thank you, Mr. Lee. Let's move on to China. Shanghai, Tony, please introduce yourself.
Hello, my name is Tony Chen. I come from Shanghai SCMC. I'm in charge of this association. So it is my great pleasure to talk to their colleagues in this area Mr. Lee has been in this area for 18 years, and also I have about a 20 years history of engagement in this area. We are getting older and older. So for the people living with HIV, they are getting older, and they are facing a lot of challenges. So that's why we want to hear more voices today. Thank you.
Thank you, Tony. Then Gofi, please tell us about you.
Hello, my name is Gofi. I'm from the Taiwan Tongzhi Hotline Association. So I've been engaged in this area for about 30 years. In 1998, so we established the Taiwan Tongzhi Hotline Association. We focused on the human rights for LGBT community. And in the recent years, we have done a lot of work in the aging people living with HIV, and we have published some books. In 2021, we published a book to review the history of 30 years of the equal rights of Taiwan LGBT group. Thank you.
Thank you. And last but not least, my co-chair, Neka.
Good evening, everybody. I am Neka Nwokolo, and I'm the head of Global Patient Affairs at ViiV Healthcare, and I'm a practicing HIV physician in London. Welcome.
Thank you, Neka. Next slide. So we heard that older people are facing unique challenges, and tonight's objective is to really better understand those challenges faced by older people living with HIV and how we can best address them. We want to hear reflection and aspirations from influential voices of our communities, and we hope to discuss actionable steps towards moving forward with a healthy aging. So before we start the session, let's have some interaction with the audience. Next slides. So I have first an open question for everyone. What does healthy aging with HIV mean to you? You may write in your own language if you like, in the chat and during the whole sessions. What does healthy aging with HIV mean to you? We'll hopefully there will be some answer and we'll come back to you on that. The next question is a poll, and we'd like to hear from all of you. Which of the following has the most impact on health and well-being of older people living with HIV? Is it A, comorbidities, B, mental health, C, sexual health, D, social isolation, loneliness, or E, stigma? I think we can look at the answer. What does our audience think? It's quite, a lot of people mention mental health, 1/3 of you, as well as social isolation, loneliness, afterwards comorbidities, and less about stigma. Let's hear from our panelists today and speakers. Over to you, Neka.
Thank you very much, Tafin. So extensive global research shows that people living with HIV bear a significantly greater burden of mental ill health than their HIV negative counterparts. And there's increasing evidence that there is an intersection between mental ill health and aging in this population. So it gives me great pleasure to introduce Professor Swen, who will talk to us about some research in this area. Professor Swen, welcome and thank you.
Thank you. Let me share the slides and then in full screen mode. Can you all see it okay? Great. Okay, so I will start the timing given that it's a very limited time that I have to go through with quite a lot. And thank you very much for having me. And I think I will use the coming 7 minutes to basically set the scene for what we're talking about tonight, which I think is a terribly important but often overlooked topic, which is aging with HIV. I think maybe some of you know that the number of older people living with HIV has increased, but I think if we look at the numbers on the screen, we still would be quite amazed that I guess the number of older people living with HIV around the world is actually much larger than what many people might have expected or might have imagined. So, and you also see the increasing number over the years. And I think it is also important to understand and dimensionalize the population, which is older people living with HIV, into at least two subgroups: people who acquired HIV earlier in life and are now aging with HIV, and also people who acquired HIV later in life. And in studies about aging and older people, we often talk about the life course perspective, which is that we have to understand the social history where people are coming from. So these two groups of older people living with HIV would be experiencing different later life experiences. And I'm sure that that is something that we can explore further tonight. And there is also, I think, the important thing to really remember that older people continue to be sexually active, and people at all stages of their life acquire HIV. And I think research shows that older people tend to delay testing for HIV. And also I think there is also a lot that we can think about the group on the right-hand side, people who acquire HIV later in life, who often also get left out of our imagination because of age-old attitudes and assumptions about sexuality and aging. Aging with HIV, perhaps not too surprisingly, presents a range of challenges in different aspects, including physical, psychological, and sociocultural challenges. And I will try to just outline some of these challenges that aging with HIV brings in the coming few slides. Physical challenges that aging with HIV brings are in different aspects: physical strain, functional impairment, and also higher prevalence of comorbidities such as cardiovascular diseases and diabetes, bone and joint disorders, non-communicable diseases as well. And yet again, now I just want to bring up, if you remember the two subgroups that I was just talking about earlier, research has shown that older people living with HIV for a longer time, they might have got more of the side effects of living with HIV for a longer time, and comorbidities is something that may affect them especially. And especially if we can go back, as I mentioned earlier, to remember that some of the earlier medical treatment that older people living with HIV who acquired it a longer time ago may mean that the side effects from the earlier days may also continue into today as well. In addition to physical health challenges, psychological and sociocultural challenges are also very important for us to remember. Not only that older people living with HIV would experience stigma related to being HIV positive, but also issues about aging as well. So sometimes we describe that they might be vulnerable at double jeopardy, that they face the stigma to do with both being HIV positive and to do with being older. So as you can see on the screen, issues about depression, substance abuse, suicidal ideation. And then I think there's also a lot that we can think about, that a lot of HIV organizations and campaigns have tended to focus on more about issues that younger people face, both prevention and support for younger people. But it seems that we also could think about perhaps a more age-friendly HIV service environment, which I think many people would agree that is not yet there. And then another very important aspect is not only the challenges that older people living with HIV face, but also the limited social support that they have. So their support networks have been described as fragile, and also issues about disclosure is also difficult for older people living with HIV, and perhaps particularly pertinent to our discussion tonight in Asia Pacific region, that a lot of older people living with HIV may find it especially difficult to disclose to family members as well as close friends as well. And we all know that non-disclosure means that sometimes people cannot be their authentic self, may have to find different ways of covering up, which would bring different costs at their mental health and also social relationships with other people as well. And you can see some of the barriers to obtaining social support there. And then I think there is a lot that later on we can talk about how to combat some of these social barriers that older people living with HIV face as well. But also don't want to just be doom and gloom in this overview with this very limited time. We all understand that people living with HIV, including older people with HIV, they are in an incredibly resilient group. And in fact, actually, especially for older people living with HIV who has lived with it for a longer time, research has shown that given the longer time that they live with HIV, it also comes more time with reflection and thinking about their experience living with HIV. So some research has shown that compared to younger people living with HIV, older people living with HIV tend to have less internalized stigma, high subjective well-being, and then they also develop different resilient resources. So I guess tonight we can also then later on also think about how organizations at different levels, as well as policies in societies, how to enhance the resilience and strengths that older people living with HIV display. So in just my very, very quick summary tonight, I just want to share with you these real take-home messages, which I hope might be useful in contextualizing tonight's sharing. Aging with HIV is a diverse phenomenon. We're talking about not only diverse genders, diverse ethnicities, but also people's own history of aging with HIV is also very diverse as well. They face a range of physical, psychological, socio-cultural challenges, and also social support and social dimension is also something that's very pertinent. However, we also mustn't forget that they also display resilience and strength as well. And so I look forward to further discussion, and I'm sure that I have oversimplified what is an incredibly wide topic, but I hope that as a starter, that might be useful for tonight's discussion. Thank you.
Thank you very much, Professor Suen. And I think you really have demonstrated how complex this area is. But I think you've also really given us a very clear overview of what the components of HIV and aging and mental health are and how they come together. And I hope that this will give us a lot of stimulus for further discussion. And so I would now like to introduce Mr. Inkyu Lee, who is going to be giving us the community perspective. And we will keep questions till the end so that we can cover both talks at the end. But if you have questions or comments that you'd like to put in the chat, please do so, because then we can address them. So please, Mr. Lee, the perspective from the community. Thank you very much for being with us.
Yes, I will begin my presentation. Korea, currently about 15,000 HIV, people living with HIV are living in Korea, and about 5,400, about 40% of that population is 50 years or older, an older population. And what they need right now is to be able to get accessible treatment. That's something right now that is difficult for people living with HIV in Korea to get proper treatment. Also, because of their old age, their physical condition deteriorates and they're frail, obviously. So that's a big issue with them. These mobility difficulties or frailty, and also the financial support is needed. They're not that financially well off, so there has to be some kind of subsidy or support from government or whatnot so that they can live, sustain their livelihood. So financial support is also important. So these are the challenges faced by older people living with HIV in Korea. Treatment access is needed, mobility difficulties have to be overcome, and financial support is needed. So there are no, right now, there's a law in Korea about HIV treatment and prevention, but in collective facilities, it says that according to this law, this law states that the HIV people living with HIV cannot even go to the army. They cannot go into collective facilities, and even in prisons as well, they have to be together, segregated and set together. So they cannot be in collective facilities such as nursing homes or so forth. So that's very inconvenient. And also other hospitals, for instance, these internal medicine, or sometimes they require surgery too, but it's very difficult to get the medical attention that they need right now, because right now, like for instance, kidney dialysis is something that a lot of HIV people need, but there's only three people in Korea, 2 in Seoul, 1 in Gyeongnam, where they can get kidney dialysis. They're rejected a lot. So like we said, when we get older with age, also they're sexually active still, and so even if they get older, they're still sexually active, and there could be exposure to sexually transmitted diseases, and the treatment timing is often missed because they don't get the proper treatment for this. And so this is also an area of concern. The hospitals have to be able to accept and understand that this population also needs to receive the proper treatment for STDs too. And like I mentioned, nursing hospitals or care homes, they need to be easily be able to be use these facilities, but it's not that accessible to people living with HIV in Korea. These issues have to be overcome. So that was the first key challenge. And let's look at the 7 key challenge for people living with HIV in Korea. For vulnerable people, like living conditions is something very sensitive. And there are some housing provided by the government for vulnerable people, but it's very poor conditions, and not a lot of people can access this as well. So we need to expand some kind of housing support or residential support for vulnerable people, such as people living with HIV. And of course, there's a lot of stigma and discrimination. I know other countries have that too, but Korea is also very large and heavy in that. So that's why people don't want to be disclosed. They have a fear of disclosure, and so they don't go actively to receive these benefits. And so we have to find out ways to approach them first, to offer them these benefits. That has to be researched and studied, I think, because they don't actively engage in receiving benefits themselves. My slides aren't going to the next slide that easily. Okay, here we go. The next key challenge, number 3, is about financial support. And I mentioned this, this is the third challenge. This is very important because they're frail, they don't work, and they have difficulties. People over their 50s, a lot in their 70s, and family ties are already severed. Let's say about 90% has lost their families, or they don't have communication with their families. So many of them are living alone, and at least they have to be able to take their medication. Let's say I'm also an HIV person, but living with HIV, but sometimes I take my medicine, sometimes I don't feel good, and I have to be able to get nutrition fully, you see, to complement my medication healthy again, right? But right now, there is some government subsidy, about 600,000 won they get, but that's not a lot of money for them to live on, right? For their basic needs, and they don't get enough protein in their diets either. So all of this is very difficult. We need to be able to support, give more financial support to these marginalized or vulnerable people. There has to be more discussions by the government bodies and try to bring about some kind of consensus, but still it's very difficult to get that support. And also, they always want to be anonymous, people living with HIV in Korea. So they always go to crowded areas of fear of exposure. About 40% of the people living with HIV in Korea are in Seoul because they want to live in the densely populated areas. And that's the psychology they live with. I think younger people as well, but also the older people. This is causing a lot of psychological or mental issues. So that has to be improved, I think. Let me come to my conclusion, basically. I talked about these challenges, but we have to actively seek out the people that need help so that we can help them to live with a better quality of life, better lives, really. So in Seoul and Gyeonggi, there's the most people living in Seoul and Gyeonggi. We have to start with these areas and then expand to other regions and cities too. But we have to expand home care, visit care to them. I think that's the biggest issue right now and problem that we have to overcome. So I talked about my presentation and I'll conclude here. Thank you very much.
Thank you so much, Mr. Lee. And what you describe as being the situation in Korea is not limited to Korea. I think these experiences that you are describing are happening all over the world, where older people are really struggling to, to manage, to live well, that they are isolated, and we are really seeing the beginnings of the consequences of those things. And so I'm going to hand over now to Tafen, who is going to hear from the community about these challenges and how they are being addressed. Thank you very much.
Thank you, Neka. So let's move on to the voice of the communities, but please ask your question in the chat, write your questions. We'll take them during the Q&A sessions. So our first panelist in this session is Tony from Shanghai. Let the floor to Tony to give us his perspective. Thank you.
Thank you, everyone. I think you can see my slides now. So no further ado, I will get started directly. My topic today is the care for the aging people living with HIV. Just a quick introduction to what we do. We are an institution focusing on the rights and health of the sexual and gender minorities. We collaborate with many health departments, academics, as well as social and media to promote improvement on the living quality of those population. We serve LGBTQ, sex workers, as well as people living with HIV, which is the focus of today. The main work we do includes the following 4 areas. We do survey and research. The second is we do training and exchange, followed by consultation and testing.
交流的一些活动，然后最重要的就是我们也会做非常多的调查和研究，就是包括我们会做比较多像老年人的一些调查研究，也能够去了解这些问题。在这个分享老年人那个 HIV 感染者挑战和问题之前呢，我非常要感谢，就是说我们中国政府它花了大量的叫做资金，特别是成立了叫做艾滋病防治基金，然后来支持我们这些NGO 去在感染者人群或者是
So in China, we have a lot of projects with some grants to support us to carry out the work of prevention and treatment for the HIV/AIDS. So there are a couple of key points I'd like to address. For aged people living with HIV, there are 4 major considerations. The first is the testing, the issue of testing. We know that a lot of HIV infectors actually are not found. In particular, the aged people living with HIV are not found because they have low awareness, they have a low wish to test it. Their belief is the life expectancy is not very long, so positive or negative, it does not matter too much to their life. And in their mind, HIV is a disease for young people, not for the aged group. Another challenge comes from the family. So we know that aged people living with HIV may face the challenge from the families. Their family members do not understand the issue, and they assume, the family members will assume that it is simply because of the problem of the sexual life. You know, in the East Asia region, it is a pretty conservative attitude to sex. So once they are found to be HIV positive, they may be, maybe driven out of the family. They have to live alone. They can't live with their children. because the family members may assume that the HIV positivity may impact their kids. In particular, they may infect their kids. The stigma over HIV may lead to a lot of problems. For example, if they go to the hospitals, they may have some discrimination. Now we have designated hospitals in China for people living with HIV. However, some of the local hospitals, the primary care, may refuse to care for the old people living with HIV. And now China has entered into aged society, and that's true for Shanghai. And if the elderly person is HIV positive, they may not be able to go to the aged care or cared by their family members like kids. For example, the aged care may simply refuse to accept these elderly people, and their other people in the aged care may refuse to live with them. So this is a big challenge. Another challenge is the health or the comorbidities. We know that the elderly people have lower immunity. So with the HIV infection, the chance of optimistic infection will be higher, and the elderly people will have a poor memory, and then the compliance to the drugs will be poor. They may forget to take a pill. So if the compliance is poor, as known to all, the control will be poor. Another issue is that the disposable income for the elderly will be lower. So as an echo to the points by Hong Kong and Korea, the financial issues are very important. If the disposable income is lower, they have to use the free drugs with a relatively higher side effects. And here I'd like to say that if you have a citizenship in China, people living with HIV will have access to the free treatment. This may be different from other areas of the world. A Chinese citizen has the access to the free treatment. So facing these issues, we can provide relevant support. And also, I'd like to show you 4 points. Firstly, is to mobilize testing. That is a one-to-one partnership. It's not only for the elderly. This a one-to-one partnership. It's for everybody, not only for the elderly. So we also provide the mental support, the psychological support. A lot of elderly people living with HIV may face a very high challenge in talking to their kids. So we have the one-to-one partnership, the consultation to help them to talk to their family members. And secondly, we have small group salon. We will invite the elderly people living with HIV with some positive attitude to come to the salon to share their stories. How could they, go out of, the darkness of their life and embrace the sunshine, and how to talk to their family members, how to tell the truth to their family members, to their kids, and how to, have a harmonious relationship with their family members. So with this kind of real life stories, other people may have a reference, may take a reference, and they will understand how to talk to their friends or families regarding the status of HIV infection. And thirdly, we provide the family and the social support. First of all, I just mentioned that in China, a lot of old people living with HIV are living with their family members, in particular their kids. The kids, their family members do not like to go to the salon to receive the education because they are worried about the stigma on themselves as well. So we go to the families, we go to the home of those old people living with HIV to talk to their family members. We will tell them about the signs of HIV, we will tell them that you will not get infected simply by living together and eating together. Living together, eating together, as simple as that, will not get people infected. This is something we tell the family members. And also we will go to the CDC and we go to the primary care, the community healthcare center to spread the knowledge there on HIV. The discrimination usually come from the ignorance or the lack of knowledge. So when we talk to them, they will start to understand. The HCPs in the local level will understand the situation, and then we can improve the level of discrimination in the local hospitals. And finally, we try to improve the self-health awareness. So first of all, we will have a regular phone call to the elderly people living with HIV. We will ask them to go to the hospital for follow-up. We will remind them of the necessity of follow-up. In China, we have a good policy that is the free drug. Not only the free drug, but also we provide two chances of having the CD4 count, and also another chance of free viral load. And also we will remind them of the liver function test, kidney function test every 3 months. And also we will tell the patient about the new knowledges. For example, the complications of lipid, the complication of liver and the kidney. So with that, we can change the attitude. For example, some elderly people living with HIV used to have the health check once every year. However, now with the HIV positivity, you need to go to the hospital and get checked twice a year or 3 times a year. So these are the information we tell them. And also, we will discuss the option of drugs with the possibility, with good affordability. It is recommended to try the new drugs, new generation of drugs, if it is financially capable, because the new drugs will have much lower side effects. We know that the early stage drugs does harm the body, but now with the new drugs, it is much better. So these are the 4 points I'd like to share with you. Of course, you can see this is the WeChat and INS. If you're interested, please find me on WeChat, on INS, on Facebook. You are more than welcome to approach me there. Thank you so much for the opportunity of sharing with each other. This is the end of my presentation. Thank you.
Thank you very much, Tony. And definitely, it's very insightful for all of us to hear what is happening in China and the challenges faced, especially in terms of the family pressure, and maybe how we can support by educating the family members. And I see comments here from when educations of family members is quite impressive what you're doing, your work you're doing there, and actually expands the benefits of peer support. So I'll ask now our second panelist, Kofi Shen, who is the founding chairman of Taiwan LGBTQ Hotline Associations, to give his thoughts as well. Over to you, Kofi.
Good evening. In this evening, I'm going to tell you a story. It's a story of elderly person with HIV. Next slide, please. Before telling the story, I'd like to introduce myself, my organization. The next slide. Taiwan LGBT Hotline Association was established in 1998 with a history of 24 years. Next slide, please. So this is the largest LGBT association in Taiwan. Next slide. We have 12 employees there. We have 8 working groups. So we have different areas of our working, including HIV/AIDS, the prevention, intimate partner, violence, transgender issues, and the community initiatives. So actually, we have more than 400 volunteers. So this is a very powerful association. We have one office in Taipei, another office in Kaohsiung. Okay, so this is the short introduction. Now I'd like to tell a story to accompany an elderly people living with HIV. So 11 years ago, when I know this guy whose name is Da Xia, he was in bed for 1 month. So he just passed a very critical illness stage. So a group of volunteers went to the hospital to see him. So at that time, he was not able to move the 4 limbs, and he had to be fed by other people. However, he still had a good mental strength, and when he told the story, it was a very vivid narration. At that time, the Da Xia, that person, was in his 70s, but he recalled his childhood. At 6 years old, his mom brought him home, and he saw a pair of shoes of a woman. So he just shouted that the cat was going to give birth to a small cats. So I like to went home. So actually, this is a kind of a trick to to avoid the embarrassment, because this is a pair of shoes of another woman. So he just told mom that I will not be here. I like to go home. So this is a smart guy. I don't think this is a joke or this is a lie, because he could tell us every detail. And then afterwards, I noted that this guy has experienced a lot, and he was really smart. He told me a lot of stories from the times, from the celebrities, and from the families. Every time his story impressed me. So every time when we met with each other, we always discussed a lot, from the family members to the lovers and to the our work, and we discussed a lot about our association. We have an age gap of 30 years. He told me a lot of old stories, old history, and more or less I knew these stories. I'd rather say that he was my friend. He was not a senior guy. He was just my friend.
I think it's probably because I really enjoy listening to different stories. So we had a lot of communications, and we had basically talked with each other for more than 2.5 years. Not for long. He started to talk about the stories with his spouse before. He never talked about it in much detail. But gradually, we get familiar with each other, and we become much closer. So he started to tell me that he is a gay at identity, and he started to tell me stories about his past spouses. I deeply know that in his old times, he used to hide his personal identity. And we always see such patient population as well. We actually had published 2 books regarding the gay community. The one book was published in 2010. The name of the book is called The Gay Population, the Storytelling. The next book was published in 2020, which is the mother's girlfriend. So there are 2 books about the homosexual community. All of them have a strong press and stress for their personal identity. But the friend told me it is great to have people visiting him. In the past, he thought that the gay community is really something that they want to hide. But after knowing him for 2 years, we started to see him getting much better in the health perspective. The physicians feel quite surprised to see his recovery so well. Daxia told me that it's because you are visiting me, so I have such a strong motive to get better. And when I become better, I would like to join you in the Gay Pride in Taiwan. Later on, the therapist of him told me, Daxia is a very persistent people. He is destined to recover. He endures all of the therapy, even if it can be very painful. He might be very stubborn when he was young, and I've heard a lot of stories from him, so I totally understand why he becomes such a stubborn people. So I'm not surprised that he holds such a perseverance during all of the therapies. And finally, he really joined us in the Gay Pride in Taipei. With the time going by, it becomes much better than before, and there's less volunteers who visit him because he doesn't need that anymore. So I'm still the last person who visits him every 2 weeks. Each time we meet, we had dinner and we share the stories. He's becoming much open-minded, and he sees the things from a different perspective angle. And each time we say farewell to each other, and I send him to the buses, and he hugged me very tightly. I can deeply feel that he doesn't want to leave. Because of the corona issue, we haven't met each other for almost 2 years already. Actually, before this meeting, around 3 weeks ago, I make a phone call and say hello to him. We talked on the phone for almost 30 minutes. He's already 85 years old, but he is still really healthy. Hearing his voice makes me well assured. I complained to him that I'm looking after my parents at home, and my dad doesn't talk too much. Well, my dad is similar years older than Daxia, but they have a completely different personality. My father never told us how he felt deeply in the heart. Maybe I don't talk with my own father that much as talking to Daxia, even during one talk. Some time ago, Daxia was infected with COVID, but fortunately, it was really a mild case. Daxia told the people who care for him, if there is really one day that he passed away, please say farewell to him in a happy environment. So starting from the beginning until now, become closer friends. Is that a part of a job at all? Or it is much beyond what our job means? I cannot tell that apart. But I deeply know that in our institution, we stay joint-handedly with those people. There's no framework, there's no system. We just be there to listen to their stories and try to know what they think and what they feel. This mindset and the principles are always what we follow when we provide care to those populations. And for the aged HIV infection, it is really important to stay with them and to show them condolences and help. We look forward to that. We can the experience from the past, and we can continue to tell more stories of the specific population. So the care institution, the medical institute, or the general population can have a better understanding and acceptance to the aged population with HIV infection. I personally have stayed with many aged HIV population. Usually we see them as a patient, but that's not exactly the same. Before we treat them as a patient, let's see them as a person, listen to their story in the first place. Well, this is actually a very important thing we do in our daily work and daily life. Next page, please. Actually, sorry, last slide. So actually, when we were writing those books, we had a lot of interviews with those population. This process can help us to understand the in-depth how they live and what they think. So that's all from me. Thank you very much.
Thank you so much, Gofi, for sharing those very touching stories, and I see the importance of accompanying to understand, to learn from them, and share their stories to others so that can help our communities. So I would like very shortly maybe to ask our speaker from the first sessions, Mr. Lee and Professor Sun, to give us a short reflection of what they hear from China and Taiwan. Mr. Lee first.
Mika? Yes. In Korean saying, we say a disease, you hate the disease, but do not hate the person with the disease. That's a saying that we have here in Korea. And I wanted to say that. This is exactly what Gofi was saying. I think it kind of touches upon that point. And because there's a lot of people that, you know, in the general population should have that feeling, not stigma or discrimination. That's just too rampant out there. So people living with HIV, they just go into the corners, into the shadows because of that stigma and discrimination, but they should not. And so people without HIV should be more have more acceptance. And I hope that stories like that and seminars like this can really cause about a ripple effect so that things can get better. I mean, right now, people living with HIV every day, a lot of people suffer. They don't know what's going to happen to them tomorrow. They might die tomorrow. Recently in Taiwan in Korea, because of Halloween event, many young people, unfortunately, there was a disaster and they died in a crowd. And I know that's a disaster, and people suffer, but people living with HIV also every day go through kind of troubles like that and sufferings, and especially for older people, really. So a lot of positive mindset we need, these events and stories. If you can just trust one person, that person becomes psychologically very positive. They become hopeful and they become ready for life. So that's what I want to say. And thank you, Gofi, for sharing those stories.
Thank you very much, Mr. Lee. Professor Sun, your take from the session?
Yeah, thank you. I mean, I just kept on like jotting so many notes and perhaps not too surprisingly, so many similarities from like different speakers. I mean, I especially I find it very similar when Tony mentioned about like older people usually sometimes the testing either is delayed or neglected, and the same when I did interviews with older people living with HIV in Hong Kong. I still remember many of them at the beginning would like say that HIV was not even a word in their mind. Many of them may either like different health symptoms showed up, and only when like quite an extreme stage of like, oh, they're already in hospital, when the doctor like asks them, oh, would you go for HIV testing? Many of them, I think, because of that age-old assumption in society that, oh, sexuality and aging can't go together. And then I think sometimes older people also internalize that and then think that, oh, testing is something for me or for younger people. And then I think also what Mr. Lee talked about in terms of like the very real issues about financial support and housing support. Similarly, in Hong Kong, like a lot of older people living with HIV say that despite in Hong Kong, there is actually an anti-discrimination law that says that HIV status as a disability should not be discriminated against in care homes. But like care homes, both the staff as well as other residents still display a lot of stigmatizing attitudes. And despite there is a discrimination law, older people living with HIV, just like other people living with HIV in other groups, in other age groups, would find it very difficult to do anything against the care homes. And also, I think the financial issue is also quite interesting, because I remember some older people living with HIV for a longer time, because they acquired HIV earlier in life, and it was a very different historical period. At that time, they would say that, well, actually, I didn't expect that I would live such a long life. So sometimes there is that issue of some older people living with HIV from the very early era may not have had a very comprehensive life planning, because some of them at the beginning may just think that, oh, okay, I've got HIV, maybe my life would be ended in the very early era. So that means that like their work and other life planning may have been affected. And then I very much agree with Goffey in terms of like, sometimes I think like, in addition to like the very concrete health and financial support, sometimes I think like older people living with HIV, just like any other, many other marginalized groups, sometimes may just like the company and the social support that is provided. In my experience with AIDS Concern in Hong Kong, working with older people living with HIV, it also took a very long time to build up the trust as well. I remember like at the beginning that when we wanted to do any social group activities, there's almost that elephant in the room that living with HIV is something that is there, but no one wants to talk about. It took a really long time to build a rapport, to build the trust, and then sometimes the company and the social support is already very important. So yeah, sorry, it's still very messy. Lots of thoughts in my mind. I just find a lot of similarities in what we all shared. Yeah.
Thank you very much, Professor Sun, and thank you for all our panelists. I'll end the voice of the committee here, and we move to a Q&A session. Over to you, Neka.
Thank you very much to all our speakers. It was really interesting and really important to hear the different perspectives from research, as well as from the voices of people who are affected by these really important concerns. So there are several questions and comments in the chat. And so I will start by asking, let me see. There's quite a lot of acknowledgement of how important this subject is. There are two questions from Crystal regarding aging with HIV. Some older people may be faced with stigma from primary healthcare providers other than departments of infectious diseases. What are some common difficulties from primary healthcare from this community? And what are current measures to prevent stigma from primary healthcare or to improve? So two questions. What are some of the current difficulties that people living with HIV may face from primary healthcare? But how do we prevent stigma that occurs in primary healthcare? So maybe I will start by asking Tony. So Tony, do you have something to say about the first question, some of the difficulties that patients may experience in primary healthcare, so in the clinical setting?
Thank you for raising the question to me. I think for this question, as Mr. Lee also said, in Korea and also in China, we are having similar challenges. When they are getting to the hospital, either primary care or in the tertiary hospital, there are all kinds of challenges. For example, in Shanghai, we have a designated hospital for the HIV infection people. Comparing 2 years ago, I think the situation already improved a lot, because a lot of communities are trying their best to provide care on the HIV patients. There are also the hospitals, even it is not designated for HIV, they usually accept HIV patients quite well. HIV infected patients can go to the normal hospital for the fever. If they need to do surgery, well, mostly HIV infected people will go to the designated hospital. But out of the community perspective, how can we improve it? And how can we better provide a better care and eliminate the stigma? We do have some discussion before already at this point. We are collaborating with different institutes. We're also working with the government authorities. So, and we're also educating the patient, the physician, nurses, and the medical workers, and the community workers. We educate them to raise awareness. We want people to know that HIV disease, usually HIV is not infected. So the physicians are accepting that point. I think it takes time, but for the past many years, I really started to see great improvement. For the past years, the stigma to HIV patients in China is really going much better than before. It is actually much better. That's what I say. Thank you.
Thank you. Thank you very much. And can I maybe just come to Mr. Lee just for your perspective from Korea, and then I'm going to go to William and Professor Swen to maybe talk about some of the solutions. So Mr. Lee, the experience from Korea.
So let me talk about challenges in the Korean market. I think we have common challenges. I think issues are not limited to Korea. Basically, doctors and physicians have to save the lives of people, but even doctors have a great fear about people living with HIV. That is a reality in Korea. So in Korea, we have a guideline for doctors. So we have a written guideline for doctors regarding treatment of the people living with HIV, and regularly we disseminate this guideline. And there are some doctors who give green light to people living with HIV, and we have a list of that. For example, dental treatment, and secondly, regarding some specific illness. So we have a list, especially we have a list of hospitals, small size hospital that can treat appendix. So we play a role as a matchmaker between hospital that can give treatment to people and people with HIV. And I hope that this will be further facilitated and accelerated in the future. And it can be really tiring to play a role as a bridge. I think it is really effective.
Thank you. Thank you very much. And that's a really important perspective, that it falls often upon the people who are experiencing the stigma to be the ones to try to address it. So in speaking about addressing it, Professor Swen, I mean, so a lot of this stigma is perpetrated by healthcare providers. And so as a researcher and as somebody who potentially might have influence over the behavior of clinicians, how do you think that we can start to try to address the issue of stigma in healthcare, both with regards to aging as well as with regard to mental health and the intersection with HIV?
Oh, goodness, it's a very big and difficult topic. I think unfortunately, like a lot of research, both with older people living with HIV and people living with HIV in general, show that stigma sometimes comes more from healthcare providers than from other people, because it is more likely that people living with HIV would have to disclose their HIV status in those settings. It's really interesting. I mean, I feel that, like, unfortunately, there is still a lot of stigma still continues to be based on ignorance and incorrect assumptions. I mean, I'm surprised that even like 1-2 years ago, when I interviewed older people living with HIV, they're still saying that service providers say that their treatment is delayed to the end of the day. Like, you feel that, like, are we talking about, 10, 20 years ago? But like, no, 2 years ago, still service providers are still like making all these assumptions. I think we just continue need to like dispel a lot of myths and dispel a lot of like fear. And it's we need to like make the training systematic, which is also continue to be a lot of challenges, because still, unfortunately, in a lot of training to do with in healthcare services training, that still gender and sexuality issues is still considered as a specialist topic that should only be discussed for 1 to 2 hours. But that, how do we like because I've also been working with groups on LGBT friendliness, HIV friendliness. How do we make service providers understand that, oh, this is not like a specialist topic that they should only devote 1 hour in their 4-year curriculum to understand, but this is about like larger issues about respect and diversity and inclusion that every healthcare practitioner should know. It's really difficult. I and many other organizations have tried. It also, I think also like for older people living with HIV, like we also need to tackle different service providers as well. We need to both work with service providers that work with older people, which may have limited understanding about HIV. We also need to work with service providers that would like more traditionally provide HIV services, but like may even leave out older people from their imagination. So we need like both a multi-pronged approach, systematic, and then yeah, there's a lot to do. Yeah.
Thank you. Thank you very much. And Gofi, I'm wondering if you have anything to add, just in terms of solutions for trying to address the issue of stigma that occurs in healthcare.
Thank you for the question. Regarding stigma, it is quite a severe case in Taiwan. For aged HIV population, they always face the challenges when visiting the medical institutes. For the physicians not in the HIV infection field, when they know that my patient is HIV infected, they may not want to treat the patient. Around 3 years ago, we worked with another HIV patient organization to try to improve the welfare of HIV people. And we have done the questionnaire and the survey through telephones. We interview a dentalist and we phone them one by one, asking if they want to receive the HIV patient or not. And we put up a list that are HIV friendly. The HIV people can go to those dental clinics. Because we always got the question asked by the HIV people, which dental clinic is friendly on us? And for the aged of HIV people, there is another challenge. When they started to be disabled and they started to lose their mobility, a lot of the nursing homes doesn't want them to be in. This is another critical challenge we face in Taiwan. I have to emphasize again how challenging the situation is. When the HIV infected people grow older, I think that's the problem. It's only going to be even worse. So for the aged HIV infected people, they live alone. They don't have enough spring. So there's no people who take care of them. If they have relatives or if they have families and their identity is not known to their relatives, all of those are great challenges that they face, and they have a significant impact on how they receive their medical care. In our organization, we have been trying to promote the primary care institute to get involved. We want them to be more friendly on the HIV people and getting more awarenesses to the HIV disease. In Taiwan, as a healthcare professional, there is such a requirement. Whether you are a caregiver or you are a physician or nurses, every year they are required to take some continuous educational program. And in those curriculum design, there's also courses about the modality, about the sexuality, about the homosexuality. Actually, in our institute, we always want to get involved. We would like to become a speaker or a lecturer during those circumstances to educate the knowledge to the physicians. Some days ago, we started to get engaged with their caregivers, and we encouraged them to understand more about the sexuality and homosexuality and related topics. And during those training programs, we try to get our hands in as much as we can. And we sometimes visit hospitals as well to provide them such a training process. So this is about what we can do now regarding knowledge sharing and awareness is building, so they can get out of their traditional controversial ideas, so they can know the most updated information about HIV. Personally speaking, this is just about the knowledge sharing. Another thing to actually change the activity and eliminate the stigma is actually in your brain. It's about what you think. Even you know about the knowledge, but you cannot change your attitude. It is the hard thing to change your behavior. The core thing here is you need to treat those people as a person first. If you think that it's just a weirdo group of people getting ill, you feel that there's this between you and other people, and they are not a part of your life. You need to think of it differently. So another thing we are trying to do is to have the gap between us away. Don't ever think that there's no infected people around you at all. Around 7 to 8 years ago, we had such an event called I Am HIV, and we have those eggs during the campaigns. We have made many stickers or T-shirts, and this is only just a symbol of that program. In this tag, there is all kinds of connections. Maybe it's your friend, it's your family, it's the people who are most close to you. It might just be your neighbor, and there is all people around you that might be gay or HIV infected. Never ever thought that it is something away from you. When you know that there are some people closer to you, maybe you can see HIV in a different angle, in a new perspective, and you may be able to have the gist and the driver know more about what they have suffered with. This is a core thing that we launched this campaign in the beginning. This is a very new book that we recently published, actually just the end of October.
Thank you.
It is called The Way to Love. So in this book, we interviewed 16 HIV-infected people's most close relatives, including their spouse, their mother, their brothers or sisters, as well as the caregivers, their friends, their teachers. We want to see HIV from a totally new, different angle. So we heard a lot of stories. In the past, we focused on the voice from the HIV-infected people themselves, but we have never heard about what the people around them feel. So this is exactly the book for. We heard 16 stories from the people around the HIV-infected people. Well, when you are reading stories, you got yourself involved, and you can feel touched. You can feel the change of their moods and what they suffer. So I think it is very helpful to change your behavior and activity. So that's all from me. Thank you.
Thank you very much for that very comprehensive answer. Prof. Swen, I see that you have your hands up. Would you like to make a comment or ask a quick question? Thank you.
I will be just very brief. As Goffey have said about caring for the aged population, it is truly really important, because for the aged HIV infected people, as Goffey said, they have don't that much opportunity to keep a good connection with their families. So the caring to the younger population and to the aged population are all very important, but it is actually very much different. In the past 10 years or more, we have been talking about these topics constantly, but it is such a broad topic. It is actually an aging society with all the countries. We cannot stand aside and do nothing. Even in Europe or the North America, we have a special facility for the aged HIV people. But actually in Asia, despite all the discussion, we haven't done anything. And there is a huge gap between Asia and the other countries. So what I'm trying to say here is, it is really important to show care for the HIV aging population. Thank you.
Thank you. Thanks very much. Very comprehensive. And I'm just going to hand back to Tafen now. Thank you.
Thank you. We are almost at time already, so thank you so much for all the sharing we had tonight. Oh, thank you so much to all our speakers. Next slide. I think I will encourage maybe all of our people in audience to think about how we can evolve HIV care for aging people with HIV in your own setting, what action we'll take after this the sessions. Next slide. We'll not have time for some additional key takeaways. I hope you have taken a lot of notes from what we have heard. So we would like to thank everyone for joining us tonight for this wonderful sessions where we heard so much from our faculty. We had so much lessons to take away. Please remember to complete the evaluation form after the events. It will give us as well a way to improve our next session. So also, this event is being recorded and the on-demand video will be made available. So follow us with hashtag Changing HIV Care in Asia. Thank you very much for joining us. Last, would like to share this image on stigma. We talked much about stigma. This is an artwork from an Australian artist designer, Daniel. He mentioned that HIV is like a mask that covers who people really are. And each part of our life that we hide our true identity and beauty. So we can remove the mask and see our true self underneath. So by talking about HIV and stigma, by educated people, we can start dismantle one piece at a time. So thank you. It has been a pleasure to host you tonight. Thank you very much and have a good night.